disease across the country and interestingly across the world. And that's when we also had research saying that by 2040 kidney disease is going to be the 5th largest killer in the world, with 1 in 3 people diagnosed with kidney disease. And Kidney Warrior Foundation, I think at that point of time, decided that helping patients on the disease was one thing, but helping general public not to come on disease was the need of the hour.
At 60 years of age, if you develop chronic kidney failure, if you are a female, only 20% of you will be alive at 5 years. This means that this is worse than breast cancer and colon cancer. Having kidney failure, you will not live for 5 years. It is worse. As males, having kidney failure at the age of 60 means only 20% of those people will live for 5 years. Again, this means that it is worse than prostate and colon cancer. So,
simply emphasizing that compared to many other diseases, kidney disease is one place. Simply emphasizing that compared to many other diseases, kidney disease is one anybody, anytime. People could become diabetic, but once you know, the neglect which people show is a problem. Like we already heard the numbers of diabetes from Sir, but any study, any world over, you take any study, the prevalence of hypertension is double the prevalence of diabetes. It's very simple. There is no doubt about that. If some study shows any number other than this, that means you have not done the study properly. So if you think India is a diabetic capital, it is double the hypertension capital. There is no doubt because the sheer number. You just can't escape hypertension. That's what we.
2 kidneys, 90% damage has to happen. Like many diseases like hypertension and diabetes, this also is silent. Second is awareness. I think Mariam and team and all the awareness what you create becomes very important. And third is prevention. An ounce of prevention is better than tons of treatment, we say. And we face the difficulties when Dr. Ranjan said about blood pressure or even simple blood sugar measurements, how people say it may be wrong or denial. Denial is the first human response to anything. So we can't blame them. We need to support them and then talk to them and then we take a call. So we are looking at India.
No carbohydrate, restrict calorie, exercise, all this. And I think one of the important parameters is weight gain.
Amount of rich food.
The program conducted by the Kidney Warriors Foundation for the general practitioners, we talked about screening for kidney disease. I request folks in the general public to be aware that diabetes, kannadadalli madhumeha, matte high blood pressure, rakta ottada, these are the two diseases that can lead on to cause kidney failure in the future. Also, you have to understand that kidney failure is a silent disease and diagnosing it early means you can actually treat and cure it. The tests that we do for kidney disease include a simple blood test called serum creatinine and a much simpler urine test called urine for protein. If these two tests are done, then it is highly possible that if any discrepancy or abnormality in the test is picked up, then that can be treated early by the doctor and kidney disease can be prevented. A further message for the general public is to approach your general practitioners in your area and ask for a blood pressure check, a blood sugar check after the age of 30. I would advise every Indian to get his or her blood pressure and blood sugar checked every year after the age of 30, and this is best done by a simple blood test called glucometer RBS. It may cost you about 50 rupees, and a blood pressure check which may also cost you about the same with a general practitioner, so that you can actually diagnose high blood pressure and diabetes very early on in your life. And if you can get it treated with lifestyle modifications may include a healthy diet, that is low in starch, that is low in sugar, and that is low in salt. We eat normally about 10 grams of salt per day. We would advise people who have high blood pressure or diabetes, with a combination of blood pressure and diabetes, to take about 4 grams of salt every day. Lifestyle modification can also include exercise. It is important to know that exercise can help reduce sugar levels, it can help reduce your blood pressure as well, and improve your muscle strength, nerve strength, and improve your cardiovascular fitness. So it is important to consider lifestyle modifications. Lifestyle modifications can also mean stopping of smoking, reduction in alcohol intake, and so on. So very important to look at some of these numbers. I repeat: blood sugar level, blood pressure level, serum creatinine level, and urine test for protein, starting at 30 years of age and continuing on thereafter. Go to the general practitioner near your house, get these checked every year, and I'm sure you can live a disease-free life. Thank you. I am Dr. Arvind, a practicing kidney physician or nephrologist and a transplant physician working in South Bangalore.
Thank you, sir.